This video's aim is to help if you are suffering with a frozen shoulder, which is also known as adhesive capsulitis, common between 40 and 60 years old. Women are more likely to get it than men. Frozen shoulder is very often misdiagnosed. Here are several conditions which can give you a stiff shoulder but aren't a frozen shoulder. Trauma, rotator cuff tear, post-operative stiffness, stroke, diabetes, thyroid, autoimmune response, neck, hormones, immobilization, algodystrophy. It often affects the non-dominant side more. There are 3 phases of a frozen shoulder. Phase 1. The first few months. Pain comes on slowly with a gradual loss in shoulder movement. Pain becomes so severe that it interferes with sleep, especially lying on the affected shoulder. Phase 2. Can last a year. Pain and severe stiffness and reduced range of movement. Phase 3. 5 months to 2 years. Gradual increasing range of movement and decrease in pain. A true frozen shoulder will resolve with time, but as you can see, it takes a very long time. To understand what a frozen shoulder affects, you need to know a bit about the anatomy of the shoulder. The shoulder is made up of the humerus, scapula, clavicle and rib cage. It has more than one joint. You have the glenohumeral joint, the acromioclavicular joint and the scapulothoracic joint. The main shoulder joint is very unstable, which allows a lot of movement, so the joint relies on a group of muscles and tendons which are collectively called the rotator cuff. The rotator cuff is made up of supraspinatus, infraspinatus, subscapularis and teres minor. The joint is surrounded and encased by the joint capsule, and it is this that the frozen shoulder affects. Basically, the capsule gets adhesions and contractures. The cause isn't known, but is linked to diabetes, heart conditions, thyroid problems, viruses, illness, surgery. But there is no exacting reasons that are known. Symptoms. Pain is usually at the front or side of your shoulder, and depending on severity, it can radiate down your arm. Severe loss of movement, which follows the capsular pattern. The most loss is from external rotation, which is this movement. The next worst loss is internal rotation, and this can be seen by putting your hand behind your back. Taking your arm out to the side is also reduced, but not as severely as the rotations. All movement is reduced, but the best movement is usually lifting your arm straight forwards and up. Diagnosis. Your GP or ideally a physiotherapist are best placed to diagnose the problem. An X-ray can't diagnose a frozen shoulder, but an arthrogram can show the reduced fluid in the joint and a reduced axillary fold of the capsule. What should you do? You should gently stretch the joint. Ice or heat can be used for pain relief. Remember to always wrap the ice in a towel to avoid an ice burn and apply for 15 minutes every 2 hours. Painkillers will help to control pain until it subsides. Take advice from your pharmacist. A physiotherapist can help to put a tailored exercise program together for you that can gradually progress your recovery. Acupuncture and other hands-on treatments can be performed to help as well. If after 3 months your movement is still severely reduced, then a manipulation under anaesthetic can be done. There is also a capsular release surgery that can cut the adhesions. Here are some exercises that you can do. Scapular setting against a wall. This exercise can help to improve your posture. Stand with your back against the wall so that your head and bottom are in contact with the wall. Keeping your arms relaxed by your sides, squeeze your shoulder blades together and slightly down without losing any contact with the wall. The wall should help you to feel the correct movement. Hold this squeeze for 10 seconds and repeat 5 times. Repeat this little and often through the day. Passive wall stretches. Try to do these little and often throughout the day. Flexion. Stand facing a wall and using your good arm, lift your arm up and out in front of your body and place your hand on the wall. Now lean your body forward so that you feel the stretch in your shoulder. Hold for 20 seconds and repeat 3 times. Abduction. Stand side onto a wall and using your good arm, lift your arm up and out to the side and place your hand on the wall. Now lean your body sideways so that you feel the stretch in your shoulder. Hold for 20 seconds and repeat 3 times. External rotation. Standing in a doorway with the palm of your hand on the frame while keeping your elbow by your side at all times. Step forward until you feel a stretch. Hold for 20 seconds and repeat 3 times. Hand behind back. Take hold of a towel at one end and dangle it down your back. Now with your arm you want to stretch, grab hold of the other end of the towel. Now using the upper arm, pull the towel up so that it stretches your lower arm. Take it to the point of stretch and hold for 20 seconds and repeat 3 times. If you get worsening symptoms or are unsure, then initially reduce the push into the discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. Once you are able, your physio can guide you through pain-free rotator cuff strengthening and proprioceptive exercises to initially maintain or slow muscle wasting, and eventually to build it back up to full strength and function. Also, it is important to make sure that you keep strength and mobility in the other joints like your elbow, wrist and even the neck.